Hi, everyone, and welcome back for another episode of Circling the Rabbit Hole podcast with me, Dr. Claire Kinuthia. It's a new week, a new conversation, and this one is a bit of a continuation because I think it's such an important issue to keep covering, but involving different stakeholders. So we've had a few episodes previously where we've talked about sexual reproductive health issues around our young adults, our youth, our teens, and young adults. And we've had some of them speak for themselves. We've had their parents speak on their behalf. And now I'd like to talk to people who work with the youth to sort of continue to discuss where the barriers are. Recently, we've had youth on TikTok talking very openly and very loudly about their sexuality, their sexual health, and the decisions they're making around the way they interact with each other. And the backlash from parents, the parents reacted with shock and horror, which is actually fascinating because I think then we must be living in a big disconnect between the two groups. So I think today my guests will help us understand a bit more where the gaps are, because they sit from, it's sort of like where I sit from, like bird's eye view, and you're looking at both parties separately. And we start to see and explore maybe what the issues really are. So, as is traditional on the podcast, I'll ask you to introduce yourselves, what you do, and then we can get into the topic.
All right, since we've made eye contact, I'll go first.
Okay.
My name is Judy Amina. The executive director of a fantastic organization called Sexual Reproductive Health and Rights Alliance.
Mm-hmm.
And there we coordinate programs around sexual reproductive health for adolescents and young people,
Mm-hmm.
and also with women. And our primary agenda is really promoting reproductive health and rights in
Mhm.
this country,
Mhm.
which we do in very many ways, which we'll be able to speak about as we continue.
Okay.
And definitely happy to be here to be able to just give a bit of my voice on sexual reproductive health for adolescents and young people.
Yeah. Thank you so much
Yeah.
for accepting the invitation.
Mhm.
And what about you?
Thank you so much. My name is Lucy Minayo.
Mhm.
I'm one of the co-CEOs at an organization called Amplify Girls,
Mm-hmm.
which is a network of about 40 organizations
Mhm.
in East and Southern Africa that working on various issues: education, sexual and reproductive health rights,
Mhm.
livelihoods, etc.
Mhm.
And the sole reason for which we exist is really to support these organizations to perform at their very level best
Mhm.
as they interact with agency programs that they undertake.
Right.
So we provide training opportunities, research, and shared learning opportunities to these organizations
Mhm.
as they work, as they work on the different programs that they interact with. And Amplify also has the distinct privilege
Mhm.
of having worked together with an organization called Girls Agency Lab Consulting
Mhm.
to actually create the first psychometric test in the world that's able to test whether your programs are promoting agency or not.
Right. Okay.
Yeah, so
Okay.
that's what we do.
Yeah.
I am a lawyer by profession,
Okay.
development practitioner. I've been in the non-profit world for the last 19 years.
Mm.
Yeah.
One of the things I love about hosting this podcast
Mhm.
is the powerful women I get to
Mhm.
meet, because I think we'll still live in a space where, as women, we're being told how we're supposed to be, or you're not allowed to aspire beyond a certain point. And yet, we are stakeholders in pretty much everything. So, who is being addressed becomes the question. So, thank you so much for joining me today. I think today's conversation, you are even better placed because now we are looking at this, like I said, from a bird's eye view, looking at the different communities. It's not just one community type of approach, but different communities, access to different levels in terms of economic status as well, and seeing what the issues are that are affecting SRHR with our youth.
Mhm.
So, just to start with, what led you to working in the SRHR space? Maybe I'll start with Judy.
Yeah. So, unlike Lucy, it hasn't been 19 years, but it's been 10 actually.
Right, okay.
I started working in the productive health space when I was quite young.
Mhm.
So the young people who are actually being targeted
Mhm.
with the program.
Mhm.
And what really led me into this was the fact that women never really get a chance to speak up.
Mhm.
And it feels like we are always negotiating
Yeah.
to be taken seriously or to be taken as human beings.
Mhm.
And of course, I didn't like that. But at the same time, I was doing a course on, I'm a journalist by profession,
Okay.
but I deviated and did development communication.
Mhm.
With DevCom, it meant that we were also looking at different issues that looked at development of people, and I chose health.
Okay.
Also based on past experiences of relatives
Mhm.
who had to compromise their health and their lives to just make society look like it's a better place or it's a better thing, and
Right.
that really pushed me into this.
Mhm.
And once in the reproductive health space, I did HIV first,
Mhm.
and that meant coordinating programs on adolescents and young people.
Mhm.
So bringing young people from around the country to work on HIV issues, kicking out stigma, and not in the way that we know of the videos
Oh,
on
yeah.
HIV
Yeah.
that were really
The ones
terrible.
that traumatized
Yes,
us.
the ones that traumatized us as children.
Yeah.
Yeah.
So in a very different way,
Mhm.
looking at sports and being able to address HIV issues,
Mhm.
but also the power of movement and
Mhm.
bringing people together.
Mhm.
And very fast, I also got into now the SRHR Alliance,
Mhm.
which is a network of several civil society organizations,
Mhm.
and they were looking for someone who's also young. I can't believe I was being looked at as the young person then.
Right.
And we were able to do also fantastic work on ensuring that young people are meaningfully involved.
Mhm.
Most of the time, we make decisions for
For them.
young people on
Exactly.
reproductive health.
Exactly.
But this meant that even with conceptualization of a program,
Mhm.
the young people are part of it.
Right.
In decision making, the boards, the young people are part of it.
Right.
Even in budgeting, we
Yeah.
are like, young people do not know anything about that.
Yeah.
Even in budgeting, young people were on it. So it continued to strengthen my work around reproductive health.
Mhm.
And then I got into advocacy,
Mhm.
which I love and hate at the same time.
Right.
It's really it's really a drive of passion
Mhm.
because with advocacy, it means it's the sitting government or the power that is there that will also help for you to achieve
Mhm.
the results that you are looking for.
Yeah.
So for policies to be implemented and to be developed that promote the lives and the health of young people, we also need a very willing government.
True.
And so it has always been a back and forth. We make 10 steps ahead, sometimes we take 2 behind, but
Sometimes
still,
50. Then we
yeah.
have to start again.
Yeah.
Yeah.
But that has been my journey. And I know when my colleagues watch this, they half of my colleagues are under the age of 27 years.
Oh, nice. Okay.
30, 27 going below,
Yeah.
and they refuse that I'm young. I think I'm young. I'm not yet 40. So
Yeah.
they
No,
refuse, but
youth is a youth thing. Don't refuse to
exactly.
be young. Yeah.
Yeah, sure. So that has been my journey so
Okay.
far.
All
Yeah.
right. What about you, Lucy?
So I feel like this is a true intergenerational conversation.
Right.
I'm that 40.
Well, me too. I don't know where you've put me, but me too.
Okay, none of
I
you
did,
is
I did
none
not
of you is old. I mean,
Yeah,
I
exactly.
I
That's what I'm
didn't
saying.
put
It's a
you there.
mindset thing.
Yeah.
Yeah, it is a mindset thing.
Yeah.
So mine was very interesting. It was the Philly Lutaya video
Mhm.
for the young people watching us.
You must
He was a
elaborate.
musician, a
Yeah.
Ugandan musician,
Mhm.
who documented when he learned about his HIV status. He documented his
Yeah.
going,
Yeah.
his departure,
Mm.
and it was the ACE communication videos, the Raphael Tuju videos, that piqued my interest in sexual and reproductive health rights. And then just in school, when I was in school, the only SRHR information we received was on menstruation. When the Johnson and Johnson people would come to
Yeah,
school and give
exactly,
us always
Yeah.
and OB tampons.
Yeah.
But professionally, I worked for an organization called the Kenya National Commission on Human Rights. It is a national body that has the mandate of promoting and protecting human rights in the country. And I served in the complaints department. And a civil society organization complained to us about how a certain public hospital in this city was denying, basically violating the rights of pregnant women.
Right.
And that led us as a commission to begin the process of inquiring into what is this situation, not just focusing on that hospital, but just nationally thinking about how is sexual and reproductive health rights exercised in the country. So that was my first real professional introduction, other than the HIV things that I knew about. That introduced me to the broad spectrum of SRHR, from pregnancy to accessing contraception, from adolescent SRHR, LGBTQI issues within SRHR, etc. And then after that, so that commission is the first in the world to undertake a national public inquiry on sexual and reproductive health rights. And it's a very good report that I encourage even the viewers to look at. It's on the website of that organization, and it speaks about the lived realities of Kenyan women and men and how they access SRHR, the barriers, issues even to do with financing, budgeting, etc. So that led me down the path of SRHR. I got into an NGO that advocates for accessing SRH services called IPAS, and then the Center for Reproductive Rights, and then I worked at HIVOS, and then now I'm here. But that book experience and just that engaging with communities pales in comparison to my experience as a parent. I have a Gen Z in my house.
Oh, wow. That in itself,
you
can write a whole book.
Is a referendum with Gen Zs. I love you all. But so it's been very interesting just seeing from my daughter's perspective how even the things that I advocate, the dissonance, even for an advocate. So when we talk about comprehensive sexuality education, and I'm looking at my daughter and wondering, how far should I go with this information with her? So so that's really what led me into SRHR. It's part of our lives. It will be part of our lives until we die. So it's been an interesting journey. And I'm excited to be here.
A good point into what we'll talk about next. We fight for our youth and access, and either making decisions around what they can access or what they can't access, or what's good for them and what's bad for them. And you've brought up a very interesting perspective where you're working in the field, where you're actually pretty much an advocate in terms of we want the best for our youth. But then it changes a little bit when you become mom. And textbook, this is what I'm supposed to do, this is what I'm supposed to say. But then upper ground, in front of this my Gen Z who will fight back and push back on everything, am I actually comfortable, confident enough to talk about these issues with my child? And then this is you who has the knowledge, the information, you have the access to even colleagues to help with how do we create a safe space for my daughter. Now the question becomes, wale wengine, those ones who were scarred by those videos and that was the end. Anyone who has never had, in fact, menstruation was, like you said, was the key thing. We didn't have a conversation about sex per se. And even when we did, it was separated. So there was, I can remember being taught how to put on a condom. And I think that was uni.
Yes, we were.
On a model.
In
that was about it. Nothing beyond that. And again, you're teaching us separately. You're separating the girls from the boys. So then, what are the barriers now? Because if it's starting from, even at the point where I have knowledge, I have information, I'm still feeling limited. I'm still feeling a bit shy. Then qua ground, what are the barriers? So what do you think are the barriers to the youth right now in accessing the services, the information that they need when it comes to their sexual and reproductive health?
Maybe I'll say one, because her organization literally lives this. Or I'll say two. I think one critical barrier that young people face, or that we face in advancing SRHR, is legal. It's a legal barrier, and before this show we had a really interesting conversation about what those barriers are, because what the law does is to introduce a significant confusion on things like access to services and exercising, like sexuality. So one, the law anybody below 18 is a child.
Mm-hmm.
And so we cannot, even when you read the Sexual Offences Act,
Mm-hmm.
it prohibits sexual engagement with somebody below the age of 18.
Yeah.
So already there's a presumption
Mm-hmm.
that these people, these adolescents, cannot
Mm-hmm.
engage in sexual conduct.
Mm-hmm.
Good and bad, I
Mm-hmm.
think.
Mm-hmm.
Good from the perspective of sexual violence,
Mm-hmm.
but when you think about the sex that's happening in that age group,
Mm-hmm.
it's experimental,
Mm-hmm.
it's consensual. There is a significant portion of adolescents who are having sex with their friends
Mm-hmm.
to
Yeah.
experiment,
Yeah.
tuone itakuwaje,
Mm-hmm.
and it's everywhere.
Mm-hmm.
I mean, for the viewers, none of us is excluded. It's
Yeah.
not a thing that's happening in Ushago.
Yes.
Yeah.
It's happening everywhere.
Yeah.
Exactly. Yeah.
And it's a global phenomenon.
Mm-hmm.
So when the law creates that already serves as a barrier, because it has an implication on provision of information to
Mhm.
this group
Mm-hmm.
and provision of services to them.
Mm-hmm.
And then now we have policies that somewhat recognize, allow
Mm-hmm.
provision of services,
Mm-hmm.
but sometimes they don't.
Yeah.
There's distinction between HIV,
Mm-hmm.
regular SRHR, if I can call it that.
Mm-hmm.
And that legal confusion is problematic for medics,
Mm-hmm.
and it's problematic for practitioners like us.
Yeah.
And it's highly problematic for the adolescent themselves,
True.
because they don't know if they can go to a facility
True.
to ask for services.
True.
They don't even know if they will be accepted. So
True.
there's a lot more work that NGOs have to do
Mm-hmm.
to now encourage the uptake of services, etc.
Yeah.
So that to me is a significant barrier.
Mm.
And a second one I'll say is just there's a lot of social stigma.
True.
If you just say you're an adolescent, that I'm going to a reproductive health clinic,
Yeah. Yeah.
everybody from the mama mboga to the watchman, to your nanny, to your parents,
Yeah.
there is a whole, and my children use a word they say creep, that you're a creep,
Oh my
because you're
goodness.
talking about sex, sexuality,
Right, yeah.
SRHR, etc.
Yeah.
So that social stigma is such a huge barrier,
Mm-hmm.
and I'm sure Judy will speak, will breathe life into that.
Yeah. Yeah. Yeah.
Well, Lucy has given me like, no, this is the person.
You are the person.
You are now
Yeah,
the
for
focus.
sure.
You are
And,
who you think you are.
Yeah. And I think for sure, I'd also love to echo that. The biggest barrier is a barrier of the system.
Mm-hmm.
Because even if 1,000 civil society organizations, we come together and provide information and services, we'll not be able to reach what the government can reach.
Yeah.
Yes.
And therefore, because they're in a service delivery, there's a lot of confusion. And not just service delivery. In the education system, we have a life skills curriculum that was done in 2008. And then we were also signatories of a commitment called the Eastern and Southern Africa Commitment on Provision of Youth-Friendly Services and Comprehensive Sexuality Education.
Okay.
And we were reporting every year. And every year when we reported, Kenya said they were at 100% that we are providing comprehensive sexuality education.
Have you
Yeah.
though?
I'm not calling anyone out. And so by saying that we are 100%, what was being looked at was the life skills education curriculum.
Right.
And by the if anyone goes and Googled life skills education curriculum, you will see what it has. Nothing on sexual reproductive health and rights. The focus mostly is on career development, on self-esteem and things like that. Maybe the only issue that it would have gone through was on abstinence.
Right.
So abstinence-based curriculums, I'm sure they do have several of their benefits, but they are not
They're
comprehensive.
not comprehensive.
They are not reaching everyone, and
Yeah.
they're actually not reaching the target group that we are looking at. So what it meant is that also teachers would consider not even having those lessons because it was not even a part of something that was examinable.
True.
So there's really nothing that they are looking at or they need to report to.
Yeah.
So that's already a failure of the system.
Yeah.
Access to reproductive health services. Adolescents and young people really need to be able to access services.
Yeah.
There's already a guideline, the youth-friendly guidelines that is in place. But in most of these facilities, there's always stockouts. So even if there is actually a little willingness, there are no commodities. If they go to the facility, some facilities started having youth-friendly centers, if you can remember,
Yeah.
Lucy. And they would have pool tables and
Yeah.
all that,
Yeah.
mostly supported by civil society organizations.
Mm.
But after playing pool, what next?
What
You
next?
don't
Yeah.
get services, you don't get even the information.
Yeah.
So it doesn't help that much.
Yeah.
And that's a huge gap. And I
Mm.
think that's also a failure.
Mm.
Third, we always separate community
Mhm.
and the implementation or the action.
Mhm.
Even sometimes when we speak as people from these spaces,
Mhm.
even professionals, when we say community, you think it's something over there.
Somewhere over there
Yeah,
in the
as
distant
if-
bush
Yeah.
somewhere.
As if you're not part of
As if-
community.
yeah, exactly.
And when you're not, when you remove yourself from community, you don't embody the challenges that also the community goes through.
Mhm.
So even when we are looking at solutions that work,
Mhm.
we look at it in a very different way. We'll bring in the heart of a doctor, a lawyer,
Mhm.
a journalist, but not someone who actually exists in this community,
True.
and bring issues that actually would be able to solve the issues in that community.
Yeah.
We, as a community or as a society, we need to have an enabling environment for young people.
Mm.
But there's quite a shyness in speaking around sex and sexuality and reproductive health issues. I don't know where that came from. I actually blame colonization to some extent
Yeah.
because pre-colonial Africa,
Mm.
there were a lot of discussions and conversations around reproductive health and
Yeah.
rights.
Yeah.
Some not in a good way, others in a good way because there was not that intergenerational gap.
Mhm.
People would speak to each other.
Mhm.
They'll know what to take to support themselves.
Mhm.
It doesn't exist anymore. So right now in the community, young people do not have a safe space to speak to people who will support their decisions around sex and sexuality.
Mhm.
They are shy to tell someone that, or even their peers, or even those who are older than them, that they would like to have sex. What next?
Mhm.
They are not supported to go to facilities and get commodities that would help them. They do not get the information from at school and even from their parents or those who are older than them or who could support them at the community. To be able to just know exactly what they would need, the step-by-step guidance on how to navigate this.
Yeah.
So when I say it's a failure of the system, it starts from governance to community level.
True.
Yeah.
I'd even go as far as to challenge a bit and go with, I don't think they're shy.
Mm.
From my experience now as a health provider, they speak to each other, to their peers, very openly. In
Yeah.
fact, sometimes if you engage, if you happen to be a fly on the wall in that conversation, even you'll be like, well,
What's happening?
I'm a bit shook. What are you guys talking about?
Yeah.
Because then you're not expecting that age group to
Mm.
have that much information, or
Yeah.
a lot of the cases, misinformation.
Yes.
But they're very actively sharing information, misinformation with each other. The problem is, like you've said, the system is failing with giving them correct information to begin with,
Yeah.
and then allowing them to know, where can I go to get the information I need, to
Yes.
get the commodities, the services, and then who is my safe space?
Yeah.
Because if I talk to mom, she shuts down
Mm.
completely. In fact,
Yeah.
our
What's
time
that?
used to be told, talk to boys, you get pregnant.
Yeah.
Oh, don't play with them. Like, where?
So
I'm
let
not
me talk.
playing.
So you can imagine someone talks to you like, sorry, no.
Who are you talking to?
So then I don't think a lot of them are held back by the fact that they don't want to know, or they don't know enough to know they need more information or services. It's the access part. It's, if I ask to go to a gynae, will mom think of me a certain way?
Yeah.
Will she force herself into the consultation? And then that means I can't say anything. Or after, because this is now what a lot of my patients will verbalize. Afterwards, they'll ask me, so are you going to tell my mom the things I tell you here?
Yeah.
Because again, that's another factor. And like you said, the law plays a big role here, because then what's the age of assent? What's the age of consent? What's the age where someone can consent without consulting a parent?
Yeah.
And for us doctors, I mean, there's actually a jail term when it comes to providing contraceptives to someone who is a minor. So then that's one aspect of the law. The penal code tells you one thing. Then you look at the constitution, it says something else. Then, like you said, the guidelines, a lot of them are very comprehensive and very accommodating. But then which one?
Exactly.
Which one do I align myself with?
Exactly.
And if someone came at me, if the police came and arrested me based on the penal code, how do I defend myself? So that confusion, like you said, creates such bad barriers in terms of even willingness to access, because I'm too scared. Who do I talk to?
Yeah.
And if I talk to them, will they follow through without telling other people? Or will I be shamed out of clinic? This is another thing I've been told. You go in seeking a specific SRHR service, and the staff laugh out loud, shout, share your information all over the place, and send you out running. Will you ever go back there
You
again?
won't go.
Never.
Actually, when I was in campus, I was shamed. I think I was in third year or
Oh
almost
my.
above 18. I
Yeah.
mean, I'm
Yeah.
out and about.
Yeah.
And I think I went to the facility and I was asking around about contraceptives.
Mhm.
And that doctor was like, "How old are you again?"
Exactly.
My
Exactly.
God, she actually screamed. Okay, not screamed, but she was like, "Oh, wait."
Yeah.
I'm
No, I've
like,
had
why would I
experiences
go
where
again?
I'm the second opinion. Someone has come from someone else and they told me, oh, I went to your colleague and they told me, keep your legs closed and focus on school.
Oh my goodness.
And I've come looking for a contraceptive. How is that a solution? You
Yeah.
know? But I think, I don't know, it's still systemic. But then the question now becomes, because we can't just sit in
Yeah,
the failure
can't-
of the
yeah.
system. For us, from the different aspects where we're sitting, how can we create safer spaces?
Mhm.
How can we encourage any youth or young person? Youth is such a us people age word, so I keep looking for the replacement. Teens and young
Young
adults,
people, they
anyone who's watching
yeah.
or listening and thinking, okay, you guys are actually talking about the issue I'm having, but
Yeah.
what next?
Mm.
So how can we create safe spaces for them?
Yeah.
Yeah.
And I think first of all, with the mandamano that happened, I think that also opened our eyes even more. Sometimes we take issues to be our own problems, but it's not our problem. It is our problem, yes, but it is not mainly our problem. Once we shift this problem to everyone else, when everyone else can feel the burden, of which they're already feeling it, but it's still not a priority, maybe.
Yeah.
Once everyone else can feel this burden, then we'll have more people responding to it. When it's just a movement of Amplify Girls, SRHR Alliance, CRR, IPAS, when it's just a few, we will not get the impacts that we require.
True.
We need to have more people speaking out, sharing, being able to just support in one way or another, whether it is online voices, offline, like the TikTok video that you spoken about. We need to see this as a problem of the people and not just a problem of a few institutions.
True.
That will be something that will give us such a leap in being able to have even policies that work for the people. Because I mean, when the people ask for it and it's not just a few people,
Yeah.
we are going to see some change. Secondly, I think it's also something that I would call on maybe everyone to look at themselves also in internal introspect. We are living by values and norms that do not necessarily work for us.
Or don't actually exist in real life.
Yes, so we are.
We like Kenya, just where we live. Here in Kenya, we have a morality,
Yeah,
hypocrisy,
80% Christians.
right? Because
Completely.
we want to aspire, or I think we insist on aspiring to morality and levels of how you should live, how you should behave, how a girl should behave, how a boy should behave. And then in real life, no one, including the ones preaching
Yeah.
to the choir, are living like that. But then what do you think that kids are seeing or doing?
Yeah.
What you say or what you're doing?
What you're doing.
So
of
that
course.
becomes the other challenge.
Yeah. So it's really a challenge for us to really remove ourselves from this moral high horse that we've created. It's not working for us. It's never worked for us. It's time for us to look at things differently. Creating safe spaces for adolescents and young people starts with us. We should be able to have these conversations without, you have these conversations with adults and they're also giggling and
Yeah.
it's let's have these conversations confidently. Let's also educate ourselves. We sometimes do not have the right language or what to talk about.
True.
There are resources. The SRHR Alliance has resources. Amplify Girls has resources which can be found on our websites. There are things that will be able to help to have these conversations. Another thing, advocacy is not also a thing of just national level. It's not a Nairobi thing only. We have what are they called? The county governments. County governments also have very specific ways and steps that could help to influence policies. We are able to hold accountable our members of county assembly. We should be able to ask of the people who are representing us to be able to do things that will come back and help us and sustain their lives, because reproductive health is also a part of sustaining our health and well-being in our communities. We should not let it just happen at one part, the national level. Everyone has a part to play. We are able to just get into spaces and have a movement where all our issues can be addressed in one way or another, step by step. It can take many years, but step by step we can surely start.
Yeah.
Yeah.
I like that.
Yeah.
Anything to add on?
Yeah, no, mine is just two things. One is I think it's important for everyone to recognize that adolescents are not the same. They are not homogeneous, right? So you have adolescents that are religious, you have the irreligious, if I can call them that, and you have they come in all shades, and so the spaces have to be created in all these areas where these adolescents are living or thriving or attempting to thrive in. So I'm a Christian, so the church has a huge role to play in creating a safe space where, let me find the right words.
I know, because you've entered.
Appropriate.
There we go, yep.
Education on sex, sexuality, SRHR is provided because it's a large catchment area every Sunday, and sometimes during the week, young people flock to the churches for kesha, for youth programs, etc. But what is the church doing? How is the church meeting their needs beyond their spiritual needs? So that's, I think it's critical. And the second biggest catchment area is the schools. And so we have to undo these myths around sex and sexuality and SRHR, because I encourage our government officials to actually just step into just one of the informal settlements. And the conversations there will be eye-opening. So this imagination that young people, they are this vacuum that they've created, that it's false. It's doesn't exist. So I think we need to reach these adolescents where they are and create those spaces where they are, and safe spaces, non-judgmental. When an adolescent comes and says they are feeling something or they are interested in this, a conversation should be had on that basis and not on what should not happen. Then two, I think it's important for our generation to actually be the change. So the Gen Zs have done incredible work in just attacking the hypocrisy in the society and mobilizing us and shining a light on all these issues that we are facing as a community. But our generation, the conversation we were having earlier about, we are the ones who are sitting in policy formulation spaces.
We are the decision makers now.
We are the decision makers. We are in parliament. We are in ministries. We are everywhere. In MCAs are us. But we are still making those funny laws and policies that are not working. The evidence is showing they're not working.
They've never worked.
So we
and we participate in the communities, so we know that they've never worked.
They've never worked. So we have to be that change. If you're in a position of making decisions, make decisions that work for the community. But the converse of that is now us who are in the homes, the parents, or the big sisters or the big brothers, we are not providing this information. We are not countering, the way the Gen Zs did aura, for example. I also did it. I'm not a Gen Z, but we did it. Which was, your hypocrisy, I will show you a bigger hypocrisy.
Exactly.
Your lie, I will show you a bigger lie. So we have to provide this information. We have to engage with the government. We have to engage with NGOs. We have to basically be active citizens in this movement of making, undoing, unlearning the stigma and the misinformation, disinformation on SRHR. Because otherwise, our children are dying. Our children are getting lost. Our children are suffering. They are struggling. So if we take the position of an active citizen, what would you want to see in your community? What would you want your child to access or not access? I think we are the generation that has to change that. And of course, the Gen Zs have already, the generations after us are doing
Showing
better
us,
than us. They are showing us that you have failed. So this is our time for us to step up.
I like that, because we tend to sit in a place, and again, it's generational because of how we were brought up. You sit in a space where you are told you don't speak to adults or speak when adults are speaking. So now when you become the adult, you don't expect pushback. First of all, you do really badly when someone talks back at you.
Exactly.
Your brain can't cope with what's happening. But then also, more importantly, you don't speak up. because you've also perpetually by the systems during our time when we were being brought up, we're taught not to speak up, not to challenge what you've been taught, and not to address or bring up an issue if it's not conforming to the general consensus. So if I'm in church and you're telling me all you're ever teaching me about is abstinence, I can't stand up and ask the pastor or the priest, okay, can we please elaborate on contraception? Because now, first of all, I'm putting myself in a position to be shamed by everyone.
Exactly.
And it will be extreme to the point where, because again, honestly, like you said, the church is one of the places people seek refuge during times of despair. And unfortunately, we have witnessed repeatedly where you say that contraception is wrong, but then now I'm pregnant because, abstinence didn't necessarily work for me, or in a lot of situations, abuse happens. So now I'm pregnant and I come to church pregnant. And what do you do to me? What's the first thing that happens to
There are
you?
churches where apparently you're removed from the book of the church.
You're excommunicated entirely. And it's not just in Kenya. It's not a unique, just Kenyan perspective. It's worldwide, where you'll be excommunicated from your community, from your church, from the people who you've grown up with, because there's this obvious pregnancy, but just the girl. Not the person responsible for the pregnancy. Just so you punish, and now whoever is watching, because then you also see you're removed from school, she was put at home, now her life is destroyed. Now me, her classmate, watching what's happened to her. Or the person that we were Bible studying together in church, and I watch what happens to her. What happens to me after that?
True.
Will I ever speak up?
Never speak
Will I
up.
ever ask a question?
No.
What happens? But I'm not protected from the same outcome because I don't have information, I don't have the services, nothing. So you kind of create a situation where we're locked in into an impossible situation, trying to aspire to a morality that's not ours.
Precisely.
And I like what Lucy has spoken about, the taking everyone taking responsibility. It's important to take these conversations at household level. So instead of from national to household, from household to national, because we don't have these conversations at household level. But when you speak with women at community level, even fathers, they're going to lament about their child who got pregnant and then got married without even the ama alitoroka nyumbani. So there's so much that's happening at household level, but we never hear of them. So really, then it's just left at those are your problems. You'll know how to deal with them.
In fact, I have a very sad story. When I was in primary school, I was in a public school. I don't think there was a choice anyway nowadays. So I was in a public primary school, a good one. And there was a girl in our class who suddenly didn't come to class. And then we heard that, her sister, who was in class 8, died. How did she die? Abortion.
Right.
Unsafe, definitely unsafe abortion. It was a rumor in the whole school. Everyone was talking about. I just imagine how this classmate of ours felt. No one to talk to. Abortion is taboo, etc., etc. And I wonder the conversation that was happening at her family level, that led her. I don't know anything beyond what was reported to us, but that led her to seek an unsafe abortion. So just associating with Judy to say, when these conversations don't happen at home, you know where children where adolescents are getting information? TikTok.
Now it's online. Now it's even worse than before.
Instagram.
Before you were limited to your community at hand.
And then you turn to just Google. And now it's Google,
now
TikTok.
it's all over. And who is on this TikTok? It's not always that you will find a doctor.
Exactly.
It will be this maybe influencer who drank green tea. It straightened their stomach. I'm just giving an example. So funny concoctions, and that's where they are getting information. Whereas if the conversations were happening at home, if we were telling if our homes were safe, and our kids could actually come home and ask, Mom, there's a boy that I normally see in the estate. I really like him. I have a crush. But are our homes safe?
Exactly.
So that even our kids can even ask about a crush. Not even about sex. A crush.
A crush.
Just
even
a crush.
Mention a boy or a girl.
Yes.
So
are they
you just even have that, start that conversation.
Or are you that bulldog who the child cannot even come to
yeah.
ask you anything.
Mm.
Yeah, and it will prevent many things, those unsafe abortions, unplanned pregnancies, early sexual debut. It will prevent, people sometimes imagine, oh, comprehensive sexuality education, we've been in those discussions. Now we are sexualizing. No.
Yes,
That's
sexualizing
actually the
children.
debate.
Yeah, we are
Yeah.
sexualizing
Yeah.
kids. Actually, the importance of that information is so that this person makes informed decisions when they
Exactly.
understand
Exactly.
comprehensively
Yeah.
that, oh, if I have sex, I can get pregnant, and this is what pregnancy means for the rest of my life.
Yeah.
Oh, I can get an abortion here, but the access is a problem in this country.
Yeah.
I could blah 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 could happen to me.
I could get an STI. I could get HIV.
I could get HIV.
Yeah.
If our homes were safe and these conversations are happening there, I think will prevent a lot of system overflow by just playing our roles in the homes.
Because again, we were adolescents once. We were
Yes.
teens once. And
Yes.
when you're told no,
you will do yes.
Yeah.
It
now
means
as an
yes.
act of rebellion
Yeah.
or to now find out what's
to
this
find
thing I'm
out,
being
especially
told
curiosity.
is so bad for me.
Yeah.
Why let's go see what this is.
Yeah.
And instead, so now I'm fighting you directly. Mom
Yeah.
told me no, so
Yeah.
let me go do
Yeah.
it.
Yeah.
And then in that scenario, I don't have information. I don't have access. I don't have. So even when the pregnancy happens or I have symptoms of an STI, I still can't talk to you.
Yeah.
So here I am going now to extremes to try and sort out an issue because we have shame around every single point.
Exactly.
Yeah.
And with the fear of CSE, I think I don't know whether it's the name. I wouldn't mind even if we call it I don't know, whatever.
Comprehensive
Yeah.
information.
Even if we call it pizza for everyone.
Yeah, truly. Maybe the name is the
Maybe
challenge.
that's the problem, because I can assure and even affirm that CSE, the curriculums that we've seen on CSE, they are more of supportive and even bringing up young people or adolescents who are more well-rounded human beings. There's issues around relationships and relationships, not just sexual relationships, relationships with your parents, with your siblings, with your friends. It's so nice. Issues around how do you even help around your community? What can I do? It will be issues around gender. What does it mean? Gender roles. This is what it is. This is how you can participate. Issues around maybe teenage pregnancies. So know what is teenage pregnancy? How does it affect? What should you do or what can you do to protect yourself from this? It's very well rounded. It's if you see these topics, it's not something you'd not want your child to go through. This is something you'd actually be pushing for your children to go through.
Yeah.
So we need to stop the fear of comprehensive sexuality education.
And I think the advice to individually start to take responsibility as an individual, because a lot of people will say, I was told by someone in church, or I was told by someone in government, or I was told by a community leader that this thing is going to teach my child this. I'm like, but see, you can
Where have
open
you seen?
Read
and
Google.
read and then decide
Yeah.
for yourself based off of what you've read. It's the same thing that how we got to the mess with the finance bill, because no one was reading it originally, so you're just like business as usual until you read the document. You're like, oh, hang on, no, this doesn't work for me. So I think taking charge individually is the most I think the biggest piece of advice we can come from this particular conversation is, as an individual, whether you are a young person or now you're a parent of a young person, or you're in between in spaces where you're working with young people, inform yourself first, educate yourself first, and then you can be able to make a difference for that other person. So I want us to wind up, because again, these conversations can go on forever.
Definitely.
And I'll just circle back to talking about the individual organizations you work for, and so that the audience can understand a bit better how they can plug in, and especially so for the young people watching or listening who would want to know, I need information, I need services, can I come to you guys? How do I access you? So maybe just that now.
Okay.
Oh, okay. I start.
Yeah.
Okay. So, as I said, Amplify Girls is a network of 40 organizations in East and Southern Africa. So, we have a number of partners that are our members in Kenya, and one of them actually does a lot of work on sexual and reproductive health rights, or several. But I'll mention this one because they run a hotline that is good for young people to know. You can call that it's called the Anti-Jane Hotline. The organization is called the Trust for Indigenous Culture and Health.
I know
TICA.
Anti-Jane Hotline. I like it. It's a very good service,
Yeah.
actually.
It is. And I mean, you can call them and ask about anything, literally anything. They are non-judgmental individuals that will receive your call. They have referral services. So they are well connected to a good network of medical providers and a good network of counselors. And there are many others. Usikimia is part of our members. Kakenya's Dream, Northern Kenya Fund, Youth Changers Kenya, and many others, partners. If I forget your name, please, it's not intentional.
No worries.
Forgive me. Yeah, but you can also get information on these partners on our website, www.amplifygirls.org.
Okay.
You can reach us. If you want to connect with a partner or you want information on SRHR, you can also reach us. On LinkedIn, we appear as Amplify Girls. You can reach us on X, Amplify Girls, as amplified_girls. And then we're also on Instagram as Amplify Girls.
Okay.
So you can reach us anytime. We'll be very happy to answer any question you have as a young person, but we can also connect you to partners that we work with and medical providers that are known to us or that are connected to our network.
Yeah. And as always, I'll put all the information in the description box hapa chini so that you can actually be able to reach out directly. Yeah.
All right. And for the Kenya SRHR Alliance, we also a network. So today you got networks. We are a network of 18 now civil society organizations. And how our network is we have organizations who work to provide comprehensive sexuality education, currently out of school because people who are barred on entry into schools in 2019. So that means we can't access students when they're in school.
Another barrier.
So we do that during weekends, during holidays, and we're able to have these conversations. So comprehensive sexuality education and information, sometimes maybe not in a curriculum, but we see information that comes on and there's need, and we'll have that conversation. And that is done online and offline. So what this does, it increases demand for access to reproductive health services, because now these are the issues and this is where I can get services. And so we have several partners who work on service delivery. Reproductive Health Network is also our partner. So they hold fort for that, where there is referrals. That's where we also make referrals. And then the third bit that we work on is on advocacy. So mainly we call it creating an enabling environment. And that is policy and legal advocacy, but not forgetting community, because for us to have an enabling environment, we need the community to be part of this. So that is, we work with organizations that work with religious leaders, like the Anglican Development Services. We work with organizations which also provide evidence, so research, so that when we are speaking, we are not just speaking out of our heads. There's research that is backing it up. So like the Great Lakes University of Kenya, who are able to provide research and will help for us to use that as basis for our advocacy. How you can find us, we are very active on our socials. So on Instagram, actually on almost all platforms at Kenya SRHR. But if you type SRHR Alliance, it will appear. So yes, at Kenya SRHR Alliance, and that is on Instagram, on X, on Facebook, on LinkedIn. But I don't feel like we are very active on LinkedIn. I also don't see so many adolescents who are on LinkedIn, but rather on these different platforms, and also on TikTok. So if you send us a DM, or you just reach out to us, we have our numbers that are on those spaces. I will be able to get back to you. I think that will be it. Our website also, www.srhralliance.or.ke. It has, we also have documents and researches, and also some things that are a bit easier to read, popular versions that are not very heavy, that will be able to help to see issues around reproductive health.
Perfect. So thank you very much for joining me. Thank you for holding space for this conversation. As our final thought, I'd like to turn it around directly onto you. So Judy, I'd want you to give a final word of advice for a young person who's listening in or watching right now, who's curious or interested in or has felt stuck in terms of their sexual and reproductive health,
Mm-hmm.
and speak to that individual specifically so that they can start to feel heard.
Mm-hmm.
And then for Lucy, I'm going to say speak to a parent
Mhm.
out there whose youth
Mhm.
in their home
Mhm.
is challenging them,
Mhm.
and they feel stuck and they don't know what to say, they don't know how to approach the topic, or maybe it's already happened and they've shut them down.
Mm.
They've already gone and said you should be focusing on school, or you should be
Mhm.
reading, you should leave boys or girls alone.
Mhm.
I would want you to give a little final word of advice to them,
Mm.
and then we'll end the episode there.
Okay. Well,
Hot
yeah, 'cause
seat
I think
moment.
yeah, there's so much to say to Aqua. So, but then, first of all, whatever you're feeling is not wrong. It's validated and it's going to happen. And all through life, there's going to be different feelings that you're going to be going through. At a personal level, at everything that you'll do, there are going to be conflicting emotions sometimes. I was once that young person and I listened to Dr. Love, but I did not get the information that I needed then. Then instead, I would advise that you try and also reach out to some of the organizations that are very willing to work with you. For example, the SRHR Alliance. We are happy to be able to guide you and just share with you in this journey to show you the information that you might require, where you might be able to get services, and just even have a little fun while learning and not necessarily to feel stuck. So you're not alone, and we are here to support you and work with you.
Fantastic.
Mm.
Right.
To the parents.
Yes,
Ooh,
to the
okay.
parents.
Let
This is
me
the tougher. This is the tougher one.
attempt. So to the parents, I'll say that I think it's okay to feel conflicted about these things when they happen, about the questions that adolescents are bringing us. What we shouldn't do is to turn adolescents away because of the fears that we have. So number one, I think let's educate ourselves as parents. Let's try to there are a lot of resources online on how to engage your teenager, whether it's even spiritual resources for the spiritual guys and non-spiritual. There is a lot of information online that can help you to navigate those conversations with your child, with your daughter, your son, etc. Two, talking to each other. The other day I was having a conversation with a friend of mine and we bonded. We are friends, but we bonded now more over shared experiences around raising teenagers. And that made me, the solidarity that it gave me was so useful. I left that conversation feeling refreshed.
Nice.
That, you're not alone.
First of all.
You're not alone.
Yeah.
So I think talking to each other, there are a lot of parental support groups, including Kwanzaa on Facebook. There are a lot of parent support groups that are useful. There's a lot of really good information in there. And then 3 is just put yourself in the, just remember how you were as an adolescent, what you needed from your parents that you didn't receive, and do the exact opposite of that.
Yeah.
I'll end it there.
Fantastic. So thank you once again for joining me for this episode. To the audience, to the listeners, thank you for staying with us till the end of the episode. Hopefully you've picked up a bit of a resource or a bit more information. And for those who are trying to navigate the murky waters, that is sexual health, reproductive health, your sexuality, don't be embarrassed. It is not something to be embarrassed about. This is completely normal and natural. And all we encourage is that you explore this in safe ways and find safe spaces, safe members of your community that you can start to engage. And if you don't have that safety within your community, like we've given today, we have lots of resources. Check out the description box for more details. But for me, it's thank you for watching, listening in on this episode, and I look forward to seeing you again on the next one.